Hey everybody, it's Cheryl. How's everybody doing? Okay, I wanted to just make this little brief video for all of you all who have been concerned about my health issue and kind of let you know the update on it. Long story short, as I suspected, I was misdiagnosed. It's been 2 months now, and they're just now figuring out what the real issue is. Initially, I had been diagnosed with cellulitis. They said, oh, you may have hit your leg or scratched it, broke the skin, it got infected, and that's why your leg's swelling up and blah, 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 blah. So after the first round of antibiotics, my leg wasn't getting any better. I went back to the doctor. She put me on a higher dosage of antibiotics, and my leg just kept getting worse. It wasn't getting any better. So I finally went to the ER. They said, well, we're going to give you some intravenous antibiotics and see how that works. Well, the whole time I was in there, they could not figure out what was going on with my leg because there was nothing wrong with me otherwise. Blood count good, no blood clots. Blood was flowing through the veins like it should. And so they were like, we're just puzzled. They did change my blood pressure medication. I've been on 4, in case you don't know that. And the one that the doctor took me off of while I was in the hospital this last time was amlodipine, which causes swelling. I feel like this really was some medicine-induced lymphedema, not something internally that just came from me. That's my opinion. When you research these medications, it will tell you what they can do. However, the doctors don't want to agree with information that you may reveal to them. They kind of stick to what they know. So that's fine. The last resort, when the doctor sent me home, he said, Cheryl, I feel like we're just giving you antibiotics. It's pumping antibiotics in you. He said, so I'm going to send you home and I'm going to schedule you to see a dermatologist. I said, okay. So finally got into the dermatologist yesterday. They looked at my leg and said, you do not have cellulitis. You have lymphedema. My leg went from a tan to black. The skin basically was fried off my leg, and then it just crumbled and began to flake off. The leg is very sensitive. So this lymphedema has to do with your lymphatic system. So the body, if you don't know, gets rid of water, but the lymphatic system gets rid of toxins and other things. So it's really two different, I'm going to say, water systems, for lack of a better term. So lymphedema is not a fast cure. I will have to have physical therapy. I have to keep my legs wrapped so that the fluid flows the way it should. Right now, my leg is very swollen. And after my last visit to the hospital, the inside of my leg blistered. So the blisters are healing. And now I can kind of get a tight sock on it, which was the goal. So I'm dealing with that. I'm still limping, but it's just something that has to run its course. They say this is irreversible. I don't know that for sure. They say some can be reversible. The doctor said to me, lymphedema is a very broad term, and it can be different. There can be so many different kinds. So I am scheduled to go to a lymphedema clinic where they will teach me how to manage my lymphedema and how to wrap my legs, different techniques. There are boots that you can wear that compress the leg. There's a lot. So I have to learn all of that. So I wanted to let you guys know. I know you've been concerned. I definitely was, because like I told him, it didn't make sense for me to have cellulitis in one leg and the right leg was starting to do the same thing. I said, I know I didn't hit, scratch, or cut both my legs. He said, you're absolutely correct. Another thought that was given to me was that I may have had what's called venous dermatitis. It's a 3-word illness. He said, you don't have that, Cheryl. I said, okay. And he said, there's nothing wrong with you. He said, you're not diabetic. You don't have, So anyway, this is where we are. I want to thank you guys for checking on me, for messaging me to see how I was. Those who brought things to me that could help me, I want to thank you for that. And so I will be seeing you guys soon with my limping self. Have a good night. I hope it's not too late when you get this. All right. See you guys soon. Bye-bye. Hey, guys. How's everybody doing? All right. So you saw my update on my diagnosis. And attached to the end of this video is going to be the entire interview with the doctor. So you guys can hear everything that went on and what was said, and then I'll be getting back to you guys with some additional information, and I'll talk about my visit to the doctor today. Alrighty? Okay, see you in the next video. Bye-bye. Yes.
I brought Dr. McCoy to come
Oh,
along.
okay. Hi.
How you doing? So sorry about the
Okay.
legs being so bad. Remind me how long has this been going on?
Since October.
Okay. Oh, you're fine.
Oh, okay. I was gonna say
Yeah,
it's
she's
fine.
really tender, so
Sorry.
that's why I'm kind of grabbing it.
I'm sorry.
Okay.
Yeah.
That's it. Started blistering like 4 or 5 days ago, and I guess it's drying up now.
Yeah.
All I did was cleanse it and put Vaseline on it. I didn't know what else to do.
Yeah.
And now you can see the bruising is. This started out like with 3 little dots, and now it's a whole square.
So and just remind me. So I know it's tender, and I know things have broken open. Has it been kind of like? And that's part of your chest kind of feeling.
Mm-hmm.
So how this is softer.
Mm-hmm. This part here, I was
Yeah.
explaining to her.
Yeah.
When I've been on 4 antibiotics.
Yeah.
Okay, because they thought I had cellulitis.
Yeah.
Not so sure now.
Sometimes it's hard on the front end for some doctors. I would say I don't think you have cellulitis, but sometimes
No,
it's hard for them to know.
Now the
that.
only reason I figured that didn't make sense
Yeah.
to me is if I hit my leg or broke the skin, why is this one doing the same thing? I didn't
Yeah.
hit both my legs. That
Yeah.
didn't make sense. Okay.
Yeah.
But when the antibiotic would like really, I guess when I would urinate or whatever, it would just squeeze this part of my leg.
Right.
And then it turned dark. It was originally all this color.
Yeah.
And then now it peeled, you know, and it's. I don't
And
know.
are you on antibiotic right now, or have been?
I'm taking the
recently?
last one today.
Okay. What antibiotic is it?
Doxy.
Okay. I think you're right for the diagnosis. I just think of like if she wasn't on antibiotics, I don't think it's truly super infected. I think it's resolving, But I think so. It's a couple of things.
Mm-hmm.
No, I don't think it's cellulitis. Yes, you have breaks in your skin. Sometimes we can have infection of a rash,
Mm-hmm.
which is where like doctors like Dr. Lou and I will talk about super infection rather than like cellulitis deep in the tissues.
Mm-hmm.
So sometimes we'll use antibiotics to try to calm that area as well.
Mm-hmm.
How long's the course of Doxy been? Probably short if it's coming from another provider, like 10 days or 14 days, something like that.
They did 100 BID for 10 days.
Okay. Do you think your symptoms got better on the antibiotics, or do you think they stayed the same? Like the tenderness, honestly. more than anything, that's actually what I want to make sure you're as comfortable at home, because we're going to talk about other stuff to do.
Yeah. Well, I think it's somewhat better.
Okay.
The fact that it's not squeezing my ankle to death and
Yeah.
causing all that. I'm not in pain. I don't
Okay.
have constant pain.
Okay.
I have points of pain.
Okay.
That may show up periodically
Yeah.
through the day, and then at night it gets worse.
Yeah.
Of course, because it's swelling. I've never had swelling.
Okay.
And one of the blood pressure medications they took me off of, amlodipine, they said causes swelling.
It can.
It can cause swelling.
Not for everyone, but it can.
Okay. All right.
I will tell you, I don't think this is the amlodipine, at least as the primary process. I think taking it off was a good idea.
Okay, all right.
Because we don't want to have more than one thing confusing it. And I think to Dr. Liu's point, I agree with the LDS. So we talk about a swelling of the legs that sometimes causes like wounds and is tender, and all the things you're experiencing, honestly. And so lipodermatosclerosis is where the tissue doesn't just get filled with fluid, but then becomes sort of thick and brown down and makes wounds. The reason I was asking about the doxy is if you think it helps at all, I don't have any problem with you using it because it can also help to push inflammation down. And everything that Dr. Liu and I are going to talk about to try to help you with this process, a lot of it involves like trying to push that fluid back in, which is hard. And anything we can do to sort of mitigate or lower the intensity of what you're already experiencing, obviously it's worth doing. So I put people on doxycycline for much less than this. So if you're like, hey, 10 days help, I'm not opposed to giving you a couple months of it actually to try to get you to the physical therapist who helped get squeezy boots to push fluid back in, and then get you under routines that help to push fluid in. Because, and I know this is like the hard part of this, they're working up all this vessel or vascular or heart stuff, which is great. Sounds like they haven't found a cause. But once someone presents with this kind of rash, our experience, and I don't just mean us as in this place, but like across dermatology, is our goal is just to stop it from getting worse. We don't have a way to make it go away. So if we calm it and we push fluid in and we stop it from getting worse, then the recurrences, the pain, the wounds either go away or become less frequent. So that's it. Honestly, that is a great accomplishment for us if we can get there. Okay, I know it's really frustrating, but that's where we are with this diagnosis as a specialty. Like we don't have a better medicine than that.
Okay, so now what if it is arterial?
I don't think it is. To
You
be
don't
clear, the way
think
it
it
looks.
is? Okay, all right.
If a study came back saying we have clearly shown that there are blockages, that's different, and I would
Because I
treat that
have
anyway.
a test scheduled for Monday, and that's why I'm just like,
Well,
okay.
and I would still do that, to be clear. Like we always want to rule out every other cause.
Right.
It doesn't look like an arterial blockage causing your leg.
Okay.
You should do that because you have vessel problems.
Yeah.
But I don't think that's the primary problem.
There's no,
I don't.
I mean, they couldn't find anything wrong with me. That's why they kept saying, we don't know what this is. I'm like, oh my God, you gotta be kidding me.
No, and I can give it a name because that's what this is.
Okay.
And that's
So
a great pickup by Dr.
you're
Liu.
thinking it's lymphedema, just lymphedema.
Yeah, well, so a specific kind of it,
Okay.
where tissue gets thick too.
Okay.
So lymphedema, just so you know, is sort of a big umbrella term where we don't return fluid from our tissues as easily.
Okay.
And venous stasis, or sometimes stasis dermatitis, a rash from fluid in the legs, causes some discoloration.
Okay.
But when it gets thick, angry, red, painful, wounds, that's where it falls into this lipodermatosclerosis category. I might even have an after visit actually, I think, for this, because this has come up enough, as in like, it's an educational thing, like, it's like, what is this thing you're telling me about?
Okay.
Yeah, so it's a kind of lymphedema.
Oh, gotcha.
And the lymphedema clinic are the ones who have the tools to teach you how to push the fluid back in.
Okay.
And they have some special boots that also help in those things. So it's
Okay.
physical therapists who specialize in this.
Okay.
So we'll put in a referral for that. They'll get you on the phone.
Okay.
As much as you can at home, and I know it's hard, like finding ways to use any kind of compression or wraps is helpful.
Yeah.
And what I would say is sometimes this is the front end of this conversation. Like, we might say eventually we want this very high millimeters of mercury or the really tight ones. Whatever you can wear is great.
Okay.
So if you're like, hey, my legs are swollen, they hurt. I can't wear compression stockings.
Yeah, I've tried it.
Yeah, but I can wear my cotton socks at home that feel a little tight but
Tighter.
don't hurt.
Okay.
Fine.
Okay.
Wear those.
Okay.
And a week or two from now, if you're wearing those and there's something slightly tighter, try that and sort of walk into whatever you can tolerate.
Comfortable, okay.
Because anything, and this sounds a little funny, but like anything that leaves an impression on your skin
Yeah.
is providing some level of compression, and something is better than nothing in helping with this.
Okay, because I told her I tried to duplicate the compression sock with bandage.
Yeah.
So I
Oh, okay.
bandaged it
Okay.
and tied up, you
Yeah.
know. And then when I took, I was like, oh God, I got these dents in my leg. Okay, but that's okay.
That's okay.
Okay.
That actually tells you it's working.
Okay.
The biggest thing, and I think if you're wrapping like an ace wrap or something home, wonderful. As long as you don't feel tingly at the toes, okay? We don't want it to feel numb, so
Right.
that's too
Right,
tight.
that's too tight.
It doesn't sound like you're doing that.
No.
But yeah, if you can see that you've wrapped and you're like, oh, I can see the dent, that's working.
Okay,
That's
okay,
working.
all right. I don't know, so I'm
No,
just
absolutely.
doing what I
Yeah.
know. Okay.
So we'll get referrals in there. We'll get you some information. The other thing, I think you probably already talked about this, but just to reiterate, keep these areas really moist because they're going to
Yeah.
be more likely to have wounds.
Yeah.
And so the moisture, as in more cream ointments you have on there, the faster they heal.
Okay.
Because they can be more prone to infection.
Okay.
So
Do
just
you have one you suggest?
honestly, just thicker is better. I just do
Okay.
Vaseline
I
or
got
petroleum
that.
jelly.
Okay, that's what I've been using.
That's what I do.
Okay. Okay.
That's what my kids' legs are smeared in right now because they run into things all the time.
Okay.
So.
Okay. I got you.
So what I say from a follow-up perspective, you can follow up with any of us, so it's at Nurturing Care Clinic, so you might see me or my colleagues who's available. In 3 to 4 months, we should see you no matter what. In between, if you're like, hey, I need an answer to this question, just send me a
Okay.
My Chart message, okay?
Okay.
And then you should be plugged into Lymphedema Clinic way before that, as in within weeks, okay?
Okay.
Okay.
All right.
What are your questions? What else can I address today?
Okay, trying to think here. Okay, you mentioned the antibiotic.
Yeah, do you want it?
I mean,
Yeah.
is that something you think I need to do, or is it?
I think if it's providing any help, if you're like, my legs felt better on it, I would just do it. I'll just be honest. I
I'm
think.
so tired of taking antibiotics. I don't know what to do.
Then here, take this. We can send the prescription. Stop taking it. Finish your course. But if you're frustrated, if you're like swell back up again, you're like, I want to try this and see
Okay,
if it
then
helps.
go ahead.
Then you have it.
Okay.
And we can, and I write it as treat month to month,
I
so I
got
would
you.
take it that way.
Okay.
But we can send the prescription. Use it if you need it during these next couple months.
Okay.
That's fine.
Okay.
Yeah, I'm not saying you have to.
I hear you.
This is a long race.
I just, I don't know. I'm like, is the antibiotic making my leg hurt? I'm thinking, God, oh Lord.
This is a very hard disease to deal with.
Complicated, okay.
So everyone struggles with it because it's just a hard thing to figure out. What do I even do with this now?
Okay.
But yeah.
Okay, all right, that sounds fair.
All right. Very good to meet you today.
Thank you so
Dr.
much.
Lee
I
can take
really
good care of you.
appreciate
No,
you guys
absolutely.
getting me in here. At least I kind of know where
Send,
it's
like,
going.
once, and then she can pick it up.
Yeah.
Yeah. I'll do 1 month and then refills.
Oh, let me,
That's exactly.
I did bring some stuff to rewrap my leg, so let me do that. Okay. Okay. Yes. Okay.
Okay?
Okay.
All right, and then whenever you're ready, you're gonna go up front.
Okay.
You can make a 3 to 4 month appointment with any provider on the way out.
Okay. Thank you so much. All right.
Happy New Year.
Bye-bye.